Miigwech, thank you for allowing me to be here. I'm very excited to be here today. And Ani, everyone, for Miigwech for being here today. I am just going to set up my slideshow. There we go. Okay, so today I'm going to be discussing self-care, COVID, and diabetes. And I'm going to introduce myself after I just do a quick agenda. So I'm going to do an introduction. We're going to talk briefly about COVID and then the stigma surrounding COVID and the stigma surrounding diabetes, the impacts that COVID-19 has had on mental health and how that it directly has impacted the population that has diabetes. And then I have a few slides that have resources, and then I'll be discussing self-care from an Indigenous lens for the Indigenous population. And then there'll be time for questions. So Jessica already went over all of the housekeeping items, so I don't really need to do that. Okay, so Ani, Bojo, Rachel Radyk, Indigenous, Anishinaabe, Kwe, and Dao, Georgina Island, Nindojabal, Waterloo, and Daya. My name is Rachel Radyk, and I'm an Anishinaabe woman from Georgina Island, and I currently live in Waterloo. I have a background being both First Nations Ojibwe, a member of the Chippewas of Georgina Island, and of settler background being both Irish and Ukrainian. I lived in Waterloo my whole life and never really had an opportunity to be involved in the Indigenous community while I was growing up. But when I pursued my post-secondary education, I was exposed to the Indigenous community and haven't really looked back ever since. And so I've been very passionate about advocating for Indigenous health and about giving back to my community while I've been on my post-secondary journey. Just a few things to kind of overview about my education and about me. So I attended Carleton University and have a bachelor's in communications. I obtained my RPN diploma from Conestoga College, and I'm currently attending Ontario Tech University for the RPN to BSCN Bridge program for my registered nurse degree, and will be graduating in about a month. So that's very exciting. And I do work at St. Mary's Hospital and for the Native Women's Association of Canada. And I'm very involved advocating for Indigenous health in all aspects of student leadership roles as well. And when I graduate, I really want to continue to work with the Indigenous populations and hopefully do some Northern nursing as well. So what is COVID? I know that everyone already knows a little bit about COVID-19. It's surrounded and impacted and taken over all of our lives. So COVID does come from a family of the coronaviruses and can cause a wide range of symptoms. These symptoms can range from a cold-like symptom to a severe acute respiratory syndrome, which needs immediate medical attention. So the symptoms do range they range quite a bit. So, and also COVID has been around for over a year now. It was discovered in Wuhan, China in November 2019. So it has been involved in all of our lives for quite a long time now. So everyone has been having to do the COVID screenings when we're going out in public, depending on your region and what the regulations are right now for isolating. So every time you go out, you have to do the self-screening. So typically this isn't always the case, but this is a nice chart that differentiates the symptoms between COVID-19, influenza, and a cold. So most individuals who do get COVID have a dry cough, they have a fever, and they may have a loss of smell or taste, tends to be a common symptom. But all of the other symptoms, such as a runny nose, sore throat, shortness of breath, headache, body aches, exhaustion, all can be symptoms as well, and it does affect everybody quite differently. Some of the more extreme symptoms that individuals can get from COVID can be severe shortness of breath. So that would be difficulty breathing, where you're having difficulty speaking single words and having to breathe really hard in between, having severe chest pain or chest tightness, having an increase of confusion or a loss of consciousness. So if you are experiencing any of these symptoms or see anybody in your household who is having these symptoms, these are medical emergencies and need immediate attention, and you should call 911 immediately. Individuals, for the most time with COVID, do have mild symptoms that can with COVID and can recover from home from these illnesses by drinking plenty of fluids, drinking your teas, and getting as much rest as possible, and having a hot shower can really open up those airways and be really beneficial. Using your natural medicines such as cedar tea, reaching out to an elder or a knowledge keeper virtually to be able to guide you with the appropriate medicines that you can use if you do have COVID can also be really beneficial and can help you heal spiritually and physically while recovering from COVID. And make sure that you're always doing the self-screening tool when you're going out for appointments and running errands. And if you're experiencing any symptoms of COVID, make sure that you are following your public health regulations to either self-isolate or to reach out to public health to obtain a COVID test. So here is a quick video. I hope that everyone is able to hear.
Here are the top 10 things you can do if you think you might have coronavirus or COVID-19. 1, stay home. 2, monitor your symptoms carefully. If they worsen, call your healthcare provider. 3, rest and stay hydrated. 4, if you have a medical appointment, call ahead and let them know you may have COVID-19. 5, if your symptoms are severe, call 911. 6, cover your cough and sneezes. 7, wash your hands often. 8, stay away from others in your home. Use a separate bathroom. 9, avoid sharing personal items. And 10, clean all surfaces that are touched often. For more information on COVID-19, visit cdc.gov/COVID-19. Let's take care of ourselves and each other.
So that's a nice video that kind of does a brief overview of kind of encompassing everything that you can do if you do have COVID and are healing at home to protect yourself and protect your family.
Rachel, someone asks a question here. What happened to common flu?
What happened?
I think just in your list, they're just looking for clarification. Perhaps they can type more.
Like the symptoms? I know that, so with the flu, some of them can be the same, but you also are more likely to have a headache, body ache, and exhaustion. But the symptoms do really overlap for COVID and influenza, except for that loss of taste and smell. But in terms of the cases of influenza that we've been seeing, I haven't encountered a single case of influenza in the hospital, and cases have really decreased with influenza during COVID. And that could possibly be because everybody is being so precautious when it comes to COVID and, wearing masks and things like that. But the symptoms are quite similar for the two of them, other than that loss of smell or taste. And this does vary for everybody, right? There are individuals that have zero symptoms and with COVID, so it's kind of just an overview to go over what symptoms could be and the most common symptoms of all of those three illnesses. So now I'm going to talk about the stigma that surrounds COVID and comes with COVID. Individuals that when they do get COVID feel that they have a shame or guilt of making a mistake for getting COVID. They have a fear of telling others that they've had COVID for a fear of being judged. They further isolate themselves and don't really want to share their experience or what is currently going on with them. They experience paranoia from the uncertainty of knowing how long the virus is going to affect them and how it's going to affect them, because the symptoms of how it impacts individuals is so unique and different. And sometimes individuals may hide their symptoms because they're fearful of actually coming to terms with the fact that they have COVID. And individuals may feel discouraged from seeking medical attention. So I did want to share a story from an Indigenous woman who shared on social media her experience with getting COVID. And if you do want to look more into her experience, you can follow her. She's Cricket Guest on Instagram if you do have Instagram. And she did, she gave me permission to share her story. So when she was diagnosed with COVID, she mentions that she immediately felt dirty and that it felt like it was a secret that she had to keep from everyone, except for a small number of individuals that needed to know within her circle. The worst part of experiencing the virus during her experience was the extreme paranoia and fear of the unknown of how severe her symptoms were going to be and the length of time that they would last. So the thing with COVID and the stigma surrounding COVID is if we continually perpetuate the negative stigma and fear surrounding COVID, it could result in individuals hiding their symptoms in fear of being ostracized or judged. This can make containing the disease even more difficult. And if people are more fearful of being diagnosed with COVID, they could be reluctant to seek medical attention when they need it. And this could be a huge risk for themselves if their symptoms become acute or they rapidly decline due to the unpredictability of the virus. So following the stigma with COVID, things that we can do. So it's really important. So stick to the facts. Make sure that you're getting your information from credible sources. So within your Indigenous organizations, such as the Indigenous Diabetes Health Circle, other health organizations, or from your healthcare practitioners, or from trusted individuals within your circle. And make sure that you're also following public health to receive updates and obtain more information surrounding COVID. Respect all of your healthcare professionals or essential workers that are working during this time, and all of our frontliners who are working right now during this time, because they experience so much fear around the virus, and it's just like everyone else, and everyone's fearful of bringing it home to their loved ones. And the best thing that we all can do to protect ourselves is making sure that we're wearing clean masks and washing our hands frequently. So how does this parallel with the stigma that carries with diabetes? So individuals that are living with type 1 or type 2 diabetes face stigma when accessing healthcare in their day-to-day lives. Individuals accessing healthcare may not feel safe when receiving healthcare due to the lack of understanding of culturally safe care as well for Indigenous populations. The diagnosis of diabetes can also bring feelings for the individual, such as blaming themselves, having guilt, shame, or failure when being diagnosed with diabetes, which are all negative impacts that perpetuate this stigma and impact the patient who has been diagnosed with diabetes. So type 1 and type 2 diabetes also generate the assumption that they both result from an unhealthy lifestyle, and that individuals assume that type 1 diabetes is considered the bad type of diabetes, with surrounding this stigma. And some common stigmas that related to type 1 diabetes can include that individuals can outgrow diabetes, or that, like I said before, it's considered the bad kind, and that you can manage the disease by making lifestyle changes. So when individuals don't really understand type 1 diabetes, this can be really negatively impacted for individuals that are living with this illness. Other stigmas include other individuals frowning upon doing injections or blood testing in public with the glucose monitor, and believing that medical issues may interfere with their ability to work, or even ridiculous assumptions such as this one I was really blown away when I read it, but I guess this is a stigma that surrounds that insulin can give individuals an advantage during sporting events. So there really is a lot of just lack of education when it comes to other individuals not really understanding how living with diabetes and what it's really like. And individuals assume also that type 2 diabetes is caused by an unhealthy lifestyle and that it's entirely their fault, which is far from the truth, as it can be impacted by genetics, ethnicity, age, which all play a far greater role than lifestyle itself. And they're also assumed to be that there could be the individual is undisciplined, and along with that unhealthy lifestyle as well, right? And another common stigma is that diabetes is no big deal. So these are all really harmful stigmas that individuals within that have diabetes have to live with on a daily basis. So the stigma of diabetes can result in preventing individuals from seeking medical care. And the stigma surrounding diabetes can result in making management of an already complex condition even more stressful. And these assumptions perpetuate the stigma of diabetes. The stigma of diabetes can prevent individuals, as I said, accessing healthcare. Individuals may not feel comfortable performing their blood sugar checks or administering insulin in public from fear of being criticized or judged. Not performing these tasks when they need to be done potentially can have very serious consequences for the individual who's delayed performing these interventions. The best way to kind of move forward from obliterating the stigma around diabetes is education. So people are slowly becoming more aware that of diabetes and its implications and the huge mental health burden that comes along with it. Living with diabetes is very difficult, and it's important to build social supports for individuals in a safe space. There is a huge diabetes online community, so seeking out for those social supports, especially during COVID, where we can only access mostly online supports, on social media groups, blogs, organizations such as the Indigenous Diabetes Health Circle, all help individuals living with diabetes feel more understood and supported. And diabetes is a lifelong job, and it's 24/7. There's no vacations, there's no days off. So it is a lifelong responsibility, and having obliterating the stigma that goes along with this is so, so important. So how does the virus spread? Just to kind of circle back a little bit with COVID. So COVID spreads from person to person by respiratory droplets of a cough or a sneeze, from close contact with someone, such as shaking hands or hugging, which is why it's so important to maintain that 6 feet distance from anyone who's in your bubble and wearing your mask. And then touching an object that the virus is on, and then touching your face before performing hand hygiene. So I like to do the example of how simple it is to do this, because I've caught myself doing this. Is you go through a Tim Hortons or the McDonald's drive-through, you buy your coffee, you give change to the cashier through the window, and you get your cash back. And then you flip open your little lid and you take a sip, and now all of those germs and bacteria have gone from the money to your hand and now onto the lid. So I really try to keep hand sanitizer in my car, and even if it takes up an extra second of individuals' time, I do hand sanitize my hands before opening my coffee and going. But so it is just keeping that mindfulness of how easy it is for those germs to move around. So I do have a quick video here that I found from the Canadian Diabetes Association.
Since the COVID-19 pandemic began, researchers have found that people affected by diabetes are not more likely to become infected with COVID than people without diabetes. But if they do get COVID-19, adults living with both type 1 or type 2 diabetes are more likely to have serious symptoms and complications like pneumonia, and they are more likely to go to the hospital. They are also more likely to be sicker and die when they are in hospital compared to those without diabetes. People who already have diabetes-related health problems or are older are more likely to have worse outcomes if they get COVID, whichever type of diabetes they have. There is new research being published so fast, we're learning more every day, and what we know today could change. Children with diabetes, most often type 1 diabetes, are not at increased risk of getting COVID-19. And if they do get the virus, their symptoms seem to be like children without diabetes.
If you live with diabetes, what are some of the things that you can do to reduce your risk of severe COVID-19 infection? I guess first and foremost, it would be doing your best not to get COVID-19 infection in the first place. And that is, of course, following all of the advice that public health has been giving us in terms of physical distancing, washing our hands, wearing face masks, and avoiding touching our face and touching our noses. However, if you were to develop COVID-19 infection, one of the things that have been shown to be associated with more severe infection is in fact the blood sugar control. It appears that those who had better blood sugar control prior to the COVID-19 infection seem to do better compared to those whose A1Cs may have been higher going into the infection. And then during the infection itself, it also appears that better glucose control during that time is associated with better outcomes. Now, this is of course not proof that glucose control can be protective, but it certainly is suggestive of that fact. So I think the most important thing that one can do to protect themselves is avoid getting the infection in the first place, and then try to be in the best possible health going into an infection if that were to occur to you. And that would mean controlling blood sugars, controlling blood pressure, and controlling any other risk factors that you may have.
There have been reports in the media that COVID-19 can cause diabetes. To date, we have not heard of such cases in Canada. But knowledge of COVID is still evolving, and the strong research needed to fully understand whether this is happening will take time to complete. However, there are a few things we do know that might help us understand what is being reported. If someone who has COVID-19 is also diagnosed with diabetes for the first time, it might be that they had type 2 diabetes before COVID and were just not aware of it. In Canada, as many as 1.5 million people may have type 2 diabetes and not know it. That's because not everyone has equal access to healthcare, and not everyone is aware of the warning signs of diabetes. If you're wondering if you might be at risk of type 2 diabetes, you can take a quick online test called CanRisk. There's a link to it on the Diabetes Canada website. And speak with your doctor, nurse practitioner, or pharmacist. Some people who develop high blood sugar levels after being infected with COVID-19 may only have these levels while their body fights the virus. Once they have fully recovered from COVID-19, their blood sugar levels may return to pre-illness levels. Cases like this were observed during SARS, the first coronavirus outbreak in 2002 to 2004. And those patients' blood sugar levels returned to normal when they got better. While some research shows that viruses may play a role in developing type 1 diabetes, it usually takes months or years after having a virus. At this early stage, the research is showing an association between getting COVID-19 and then being diagnosed with diabetes. This doesn't necessarily mean that COVID causes diabetes, and more long-term research is needed to figure it out. To summarize, we need more research to understand if COVID-19 causes diabetes. Or are some people just finding out if they have pre-existing diabetes when they get COVID? An international group of leading diabetes researchers are working on finding the answer to this and other questions. Diabetes Canada will continue to monitor the research and provide updates and interpretations of this complex, ever-evolving situation.
If you live with diabetes, should you be vaccinated for COVID-19? The answer is yes. There are data in people living with both type 1 as well as type 2 diabetes within the COVID-19 vaccine trials. So therefore, yes, it is appropriate for you living with diabetes to get the COVID-19 vaccine. Now, in terms of prioritization, one usually turns to the National Advisory Committee on Immunization, also known as NACI for short, and they recently put out recommendations for COVID-19 prioritization. And those living with medical conditions that can cause more severe COVID-19 are included, and they are included at this present time in stage 3 in terms of the level of prioritization. So therefore, to recap, it is safe and appropriate for someone living with diabetes, be it type 1 or type 2 diabetes, to get the COVID-19 vaccine when it is in fact your turn to do so. And from a prioritization perspective, it has been discussed by NACI in their latest recommendations.
So I thought that video was a nice recap of everything. So just to recap what everything that was kind of said of the main points of that video, one of the best things that you can do to avoid getting COVID is obviously maintaining public health guidelines, washing your hands, wearing a mask. If you do happen to get COVID, preventing worsening of symptoms, possibly it could help and is really beneficial to be managing your blood glucose levels and making sure that they are within normal range to hopefully have a better outcome from having COVID. And then also just to touch on the fact that I know that they did say that individuals living with diabetes are in phase 3 of the vaccination strategy. However, Indigenous populations are within stage 1 of the vaccination strategy. So just to highlight that actually is a little different for individuals living in the urban Indigenous population, and vaccine rollout is happening within the different counties and regions throughout this time. So individuals may be getting vaccinated quite shortly, living in depending on the region that you live in. So how can you protect yourself? We already kind of went over this, so just a brief summary: wearing your mask, making sure that it's a clean mask. I see so many individuals, and you see all of the disposable masks hanging on their windshield. So having all of those masks on there like that can actually cause bacteria to grow in those masks. So making sure that if you're using disposable masks, to keep them clean and to dispose of them after a day of use, or investing in getting reusable masks and washing them on a daily basis. Washing your hands frequently, either with soap and water or with alcohol-based hand rubs. Staying 6 feet apart from other individuals who aren't in your bubble when out in public. Avoid touching your face. and cleaning surfaces in your living space frequently. And then cleaning produce with running water when you do go to the grocery store. Don't wipe anything down in terms of your fruits and veggies with any cleaning products or anything like that that can actually be more harmful for you to ingest. But it is safe to wipe down with a Lysol or anything, cardboard boxes or any other containers or things that you do buy from the grocery store. So protecting yourself when you live in a shared living space, depending on where you live. So that could be an apartment or a condo or even a residence if you're a student. So trying to maintain social distancing while in shared areas such as the hallways, and making sure you're wearing a mask while in any area of your apartment building that is a shared space. And cleaning your hands with alcohol-based hand rub after touching high touch areas. So high traffic areas such as doorknobs, elevator buttons, handrails, anything like that can decrease your chances of getting COVID while living in a shared space. So how large can your social circle be? So that really depends on the recommendations of your public health guidelines for your region. I know that the GTA area is still in the gray zone. The area that I live in Kitchener-Waterloo, is in the red zone. So making sure you determine your bubble and your circle and what you can and can't do based off of your public health guidelines is really important. Staying 6 feet apart from everyone else who is not in your household or your bubble, depending on what the guidelines are for your region, is also really important to protect yourself. So during COVID, the mental health impacts have been enormous. In the beginning, when COVID started, mental health services were halted and were made less accessible for many individuals. Now, as the pandemic progresses, many mental health services have been transitioning to online or phone to increase accessibility for individuals, but this can also raise barriers for individuals who aren't living, let's say, in a space where they feel free to really talk or express their feelings or emotions, or may not have accessibility to internet. So there are still barriers with this as well. And there have been massive negative impacts on Canadians' mental health, with an increase in stress levels ever since the start of the pandemic. So the WHO actually created a survey that assessed the mental health, neurological, and substance services during COVID-19. So during this time, it was looking at how individuals accessing mental health services during this time on a global scale were impacted, and over 60% did report that there were disruptions to their mental health services, including individuals who were vulnerable, including children and adolescents and older adults, and women that were requiring antenatal or postnatal services. So this is massive that individuals within these populations were not able to access the services that they needed. And also more than 1/3, so 35%, reported that there were disruptions to emergency services that were needed as well for people that were experiencing seizures or substance abuse withdrawal symptoms and delirium. The negative impact that Canadians have felt has really increased the amount of stress, as I've said before. Many Canadians are struggling with the fear and uncertainty about the health of themselves and their loved ones, and people are really worried about their job stability and income, as well as dealing with social isolation. So there's many factors that are coming into compounding during this time that are really impacting individuals. A recent poll also found that 50% of Canadians reported a worsening of mental health since the pandemic began, and more than 40% were anxious and worried about the pandemic, and 1 in 10 said that their mental health had worsened a lot as a result of COVID-19. There's also been quite a few individuals of the vulnerable population who have had increased anxiety and depression because of losing their job due to the pandemic, individuals with health comorbidities being increasingly anxious about accessing healthcare or even going outside because of COVID, and then individuals with children at home and young people are more likely to experience depression and anxiety during COVID. So this is a quick video that shows and overviews and does a really great job of showing the different ways that COVID has impacted individuals' mental health.
Hey, Psych2Goers. We'd like to say that we're here for you during this difficult time of COVID-19. Stay safe, everyone. The coronavirus pandemic is affecting all of us right now. It's caused a lot of changes in the world. While your mental health should be taken seriously all the time, it's particularly important during this pandemic. So here are 10 ways that coronavirus affects you mentally, and we're here to validate those experiences in case you feel like you're alone in them. Number 1, mob mentality and panic buying. There's a lot of panic going around, and it's worsened by mob mentality, which is when people are influenced to behave in an overly emotional way by those around them. Even though stocking up sounds like a good idea, hoarding too much will lead to a shortage for others who really need it. Some people might hoard because of their belief that there isn't enough for everybody, but there is. 2, feelings of emotional isolation. Social distancing means we have to keep physical distance between ourselves and other people. It's the responsible thing to do to flatten the curve. But being physically isolated can lead to feeling emotionally isolated. Loneliness is the last thing anyone wants to feel in times of crisis, so be sure to reach out to friends and family. Take advantage of technology that allows you to feel connected to loved ones across great distances. 3, boredom. Even when you're working from home, being quarantined inside your house for a long period of time can make anyone feel uneasy. This is especially true for people who are extroverted and aren't used to staying in. It's important to know you're able to conquer boredom. Make a list of things you've been meaning to do, like hobbies to start, books to read, home projects, games to play, and so on. 4, overconsumption of news and media. People have constant access to the news all the time, and sometimes it can be filled with inaccurate information that only intensifies your fears. So make sure your sources are credible and factual, especially when you share it online. While it's good to stay informed, too much can also negatively impact your mental health. Be mindful of how much time you spend consuming the news, especially during this pandemic. 5, added stress to your life. Life was stressful enough with work, school, and relationships, but with the pandemic, it could make it much more difficult and stressful to manage everything. Approaching stress with a calm and practical perspective is essential. In fact, the Center for Disease Control's coronavirus webpage includes a section on managing stress. It's important to remember that this situation is temporary and that we'll make it through this together. 6, worry about loved ones. Although it's good to be concerned about other people and how they're doing during this time of crisis, too much worry can increase the stress hormone in your body and suppress the effectiveness of your immune system. The best way to keep yourself and others healthy, especially the elderly and immunocompromised people, is to stay home. Use text or video chat to stay emotionally connected with them and make plans for when the quarantine is over. 7, stress about finances. Since all non-essential employees have been told to stay home, many are now out of work. Going without a paycheck is stressful and can bring up other financial troubles. The American Institute of Stress found that 76% of Americans cite money and work as their leading causes of stress, which speaks to how extreme the issue is. But being stressed all the time can lead to other health problems. 8, normal schedules and routine is interrupted. The new coronavirus preventative measures have caused a lot of interruptions in people's schedules and routines, such as going to work, school, the gym, going to your favorite restaurant, and so on. While it can be hard to adjust to all the new changes, have faith. This is going to be temporary, and we'll soon be able to get back to our normal routine when the outbreak dies down. Perhaps this is a great time to binge watch your favorite TV show on Netflix that you didn't have time to watch before the lockdown. 9. Concern about your physical health. Of course, we're all worried about our physical health during this outbreak, but being excessively anxious all the time can also affect your mental health. In this time of difficulty, make your health a priority by taking the necessary precautions against the spread of the virus. Make sure to eat healthy and move your body. Practice self-care as often as you can. And 10, concern about the world. It's natural to feel anxious during this pandemic, but too much anxiety can be detrimental to your health. Remember that we can only control our own actions, so wash your hands frequently, don't touch your face, stay home, and remind yourself that by following these rules, you are doing your part to help everyone else. We all have to do our part to weather through this crisis, so stay safe, practice social distancing, be kind to other people, and take care of yourself both physically and mentally. If you found that
I think that video is so great because it validates everyone's feelings of mental health that they may be experiencing during the pandemic and shows how it's impacted individuals in so many different ways. So mental health has impacted individuals with diabetes. So as I said before, living with diabetes can be stressful, and it is a 24/7 job that an individual always has to care for. You always have to be checking your sugars. You always have to be really monitoring and being mindful of your diet and your everyday routine with your medications and etc. You can't really take a day off from those things. So on top of that, increasing stress can make it even more difficult to manage your diabetes. And with everybody being so stressed from COVID, there is such an impact from this, and it can cause an increase of anxiety and mental health issues. This can lead to individuals having that increased anxiety and fear to go out and to go to even their medical appointments or seeking medical attention during COVID and avoiding the hospitals if they're having a medical emergency. And this can lead to a negative impact for the individual. And this can make and on top of that, an already stressful and potentially traumatic experience accessing the hospital or healthcare for individuals within Indigenous populations. It can be compounded by all of these issues of the fear of COVID and as well. There's also been a two-way relationship between diabetes and mental health challenges. So 30% of individuals in a Canadian report that are living with diabetes also report having depression. And individuals with depression also have an increased risk of 40 to 60% of developing type 2 diabetes. Also, Indigenous people have the risk or do experience and face discrimination when accessing healthcare. So this increases all of the mental health implications and the stigma that can surround diabetes as well, and for individuals that are accessing healthcare. There's also been a cancellation of in-person support groups for diabetes management. So individuals that may have been attending Indigenous diabetes health circles or anything like along those lines have now had to switch to support groups that are switched to an online delivery. However, this can create barriers for individuals who may not have access to the internet. Individuals and elders and communities and individuals have had to go from being in person and having communication and interactions to now being on the telephone and online, which can be really difficult for, when you're missing that daily in-person day-to-day interactions, and can have detrimental health impacts. So here are a few supports, and I do have a resource list as well. So if you do feel like you need support during this time, there are some options for Indigenous populations. So the Native Women's Association of Canada has an elder support hotline for specifically for supporting individuals in the Indigenous population during COVID-19. So they're available from Monday to Friday from 9 to 11 and then 1 to 3, and the number is there. And then there's also the Talk for Healing if you prefer texting, or you can call them as well. And then there is a lot of resources and support networks within the Indigenous Diabetes Health Circle as well. And then also CAMH if you prefer more of a online chat setting, there is they have a forum to discuss COVID-19 as well, and to talk to professionals about answering your questions. So this is a quick 30-second video about that. So there are lots of different resources out there, depending on how your preference is for accessing those. There's lots of different opportunities to do so. So now we're going to discuss the self-care component of caring for, introducing and doing self-care during COVID-19. So one of the main things that this is from a resource from the AFN, so the Assemblies of First Nations, and I thought it was awesome. So I decided to put it in my presentation. But I think that it's really great to incorporate that a portion of self-care is taking a step away from your work every 20 minutes when you can, or when you can. So maybe every hour, just making sure that you're standing up and moving so you're not sitting for an extended period of time. And so self-care is an activity that we do deliberately to take care of our mental, emotional, or physical health. Good self-care is key to an improved mood and also in decreasing anxiety. And it's also the key to a good relationship with oneself and others. It's also important when talking about self-care to also highlight what isn't self-care. So knowing what self-care is not might even be more important. Self-care is not something that we have to force ourselves to do or something that we don't enjoy. So when you're thinking about starting incorporating self-care, a great place to start is by creating a no list. So these are things that you don't like or no longer want to do. So examples could be checking your emails at night. So setting those clear boundaries as individuals are working more from home during this time. Not attending, well, nobody's attending gatherings really that we don't like right now, but maybe not attending virtual gatherings if you don't feel that you're up to attending them right now. And then not answering the phone during lunch or dinner. So taking that time for yourself to really have that time with yourself or anyone that you possibly live with as well. And as I said before, setting boundaries during this time is so, so important, especially for individuals that are working from home, doing school from home, or, just during this time as well for your own mental and physical health. Setting those boundaries is so important. It's also, so when you're starting a self-care routine, starting small when you're creating your routine is really great. Breaking them down into small tasks is really important. So that's why I really love this resource. It really breaks it down into small things that individuals can do to incorporate self-care in their lives. So calling an elder or a relative, getting outside and connecting with the land. The weather is becoming so much nicer and so much more beautiful outside. So that can be an even greater time to go for long hikes or get outside and just enjoy the land and get connected with the land. Learning, if you're learning more about your Indigenous language, if you don't know, I have been learning a little bit more about my language, so that's been a great experience for me. taking some time and creating something. So that could be some art, some music, or a handcrafted item, doing some beadwork or some painting, taking some time to just be with yourself and to do that crafting. And then practicing your culture in a traditional method of healing. So taking that time to smudge if you smudge. I've been incorporating and being really mindful about incorporating smudging into my life more, because I think that it's really created more of a balance in my life. So finding ways to practice during this time, especially when we aren't able to gather like we would before. And then stretching while at your desk. There's lots of resources for stretching while working, or taking that time to practice some meditation and yoga, listening to your favorite music or listening to a podcast, making sure that you're keeping active, doing a home workout, dancing or running, and trying a new recipe or trying a traditional dish. Also, making sure that you're following up with your medical care and your medical appointments, because that is also taking care of your physical health. Making sure that you're not putting off checkups with your doctor. I know that some doctors are doing virtual checkups, so making sure that you're really advocating for yourself and your healthcare during this time. Taking proper care of your diabetes management is also a practice of self-care. So making sure that you're checking your sugars as your doctor has recommended, usually about 3 to 4 times a day. So with meals and then at bedtime. And taking proper care of your feet. So making sure that you're decreasing your risk for developing issues, doing your foot checks, and going to see your foot care as needed if those are services that you access. And then using traditional medicines. So as I said before, smudging to starting your days in a good way. If you do smudge, incorporating other medicines. So cedar tea is really great because it can help manage blood sugar levels. And then spending time with loved ones, even if it's virtually, can be connecting with individuals is really important during this time. And also with other terms of self-care, if you are an individual who likes to use Indigenous products, Sister Sage or the Yukon Soap Company have some great soaps that incorporate traditional medicines into them that can be used to when practicing self-care to protect yourself and your physical health of washing your hands. So I really love this image that I found. So it's self-care and divides all of self-care and different aspects of self-care that you can do into a medicine wheel. So incorporating that spiritual, emotional, mental and physical aspects to help treat with the whole individual. So in spiritual, you could do things like drinking healing teas, that cedar tea that can really help with blood sugar. Practicing acts of kindness, using your medicines, learning more about the language. For emotional, we can call and connect with a loved one. We can create a gratitude list. We can seek support or watch a funny video, as laughter is really good medicine as well. For a mental aspect, practicing mindfulness, taking those deep breaths, and taking time to reflect and contemplate on everything that's been going on during the pandemic. It has impacted everybody differently, and taking that time to reflect and acknowledge everything that has been experienced is really important. Even during the pandemic, still maintaining a set routine can really be beneficial to your mental health. And taking breaks from social media and the news, as it can increase anxiety with all of the information overload that is going on right now with COVID-19. And in terms of our physical health, washing your hands, drinking more water, getting enough rest and sleep, and taking in food as medicine. So, making sure that you're eating those foods that are good for your health and for your diabetes management as well. And then another part of self-care that we can talk about as a protection of our physical health that has come into the pandemic now is the COVID-19 vaccine. So in Indigenous communities of the urban Indigenous community are able to start obtaining the vaccine. This does depend as per the region that you are in, but everyone within the Indigenous community is eligible to get the vaccine and is a part of the priority community. In urban communities, it's 16 plus for individuals that are able to get the vaccine. So just to myth bust some facts about the vaccine. So the COVID-19 is not the flu. The seasonal flu vaccine will not protect you from COVID. So you need the COVID vaccine to protect you from COVID. You cannot be infected from COVID-19 from the vaccine. And the Pfizer and Moderna vaccines do not change your DNA. And vaccines do not include antibiotics or any latex or metals in them. And however, vaccines are not mandatory, but they are extremely beneficial for individuals, especially individuals living with diabetes, as it is seen that individuals with diabetes can have more of a negative impact from COVID-19. So where can you get vaccinated? So reach out to your regional public health. A lot of them have already released their immunization strategies for the Indigenous populations, or also reach out to your local Indigenous organizations to receive more information about where to be directed to receive your vaccine. And just some health teaching for after you get vaccinated for what you could expect. You could experience a fever, a headache, some arm pain at the site where you've had your injection, and some increased tiredness. And now public health, there has been a change in the duration of when you can get your second dose. So your second dose could be 3 to 4 months away from your first dose now, but your body will start building up those antibodies to fight off the COVID virus after the 3-week period. So you are still protected during that period, even if you only get the one vaccination until you get the second dose when you're scheduled during that time. And then this is just a short little pictures that really show and break down how simple it can be to incorporate self-care into your life. Self-care doesn't have to be this daunting task where you have to do all these things, but self-care can be things such as staying home, saying no, taking a step back, and really setting those boundaries, as we've said before, as those can all really help your mental health. Spending time alone if you need it. Sometimes during COVID in the lockdown, we've been having to spend more time with individuals. So really taking that time for yourself if you need it, and putting yourself first when you're able to. Making sure that you're booking and keeping up to date with your appointments, getting outside, and taking some time to do some mindfulness and breathing, and making even as simple as writing 3 nice things about yourself. These are all things that you can do to incorporate self-care into your daily lives. And now I can take some questions, and I just want to say miigwech to everyone for listening, and that I hope that everyone stays safe and healthy during this time.
Miigwech, thank you, Rachel. Thank you so much. Wealth of information you've shared with us today. I do have one question pending in the chat box that I'll get to right away, and then we can see if anything else comes through as you answer that one. So Tracy asks, I think I had COVID in December 2019, January 2019. I was really sick. Would I be immune to it now?
So this is a really good question. And individuals who have had COVID in the past, if you've had COVID, your body may have built up some antibodies, but that won't be as effective as obtaining or receiving the vaccine, as the vaccine has been created to really protect from all different aspects of COVID, as there could be different variants out there. So you might only have build up some antibodies from one variant of COVID that is out there.